Hey, Bright Lights, welcome back to the Architecting Podcast. Today we are celebrating Earth Day with our special guest, Molly Scanlon. Hi, Molly.
Hi, how you doing?
I am good. So, we have been longtime colleagues as healthcare architects in the American College of Healthcare Architects. We've worked on quite a few initiatives together, and I've always appreciated your insights, your point of view, how you connect research back to real world problems. So, love it if we get started just telling people, how did you come to be doing what you're doing today?
Well, I think of myself now, I use this analogy, is that you're a tree and you come into the world and you somehow lay a seed or a root. And then those of us that are developing a career, it kind of has branches. And I think the old career was mostly trunk and maybe not as many branches. And so I started out in my trunk wanting to be an architect and never had any dreams of anything else. Um, but we'll go into some of this later. But the my trunk I developed really early in my career, and I kind of reached almost the top of management of what I was doing by the time I was 30. And so I was licensed, I had practiced, and I got into healthcare architecture through my degrees. And I was formally trained in that at Clemson University for my bachelor's and my master's. But I kind of accelerated quickly in my career. And so as I got into my 30s and then early 40s, I was sort of tapping out, for lack of a better word. And so I wanted to do more branching on the tree. And things like evidence-based design were coming into vogue. And because of my background of having a master's in health and applying research, I kind of said to myself, do I want to do the research or do I want to apply the research and remain in practice? And I was getting burnt out, frankly, from being in the profession, being in a minority as a woman in the profession, and running up against what people call the glass ceiling. And so I went back to get my doctorate in my 40s. And I shopped around for that doctorate. And I wanted to be a health doctorate, but I kept interviewing and talking to different people and considering business degrees and what are called organizational management degrees or something in that regard because I was in management of a firm. And so I eventually ran into a US Surgeon General that said, you're talking about public health, but you don't know you're talking about public health. And
Uh-huh.
he said, you need to go and investigate public health degrees because you're not going to go into a college of medicine, but you're going to be adjacent to that in the research area. So public health contains the epidemiologists, the environmental specialists that study policy that's made in public, and health promotion, health prevention, and I'm trying to think biostatistics, so the formal statistics. And as so I went and took a certificate first to see if I liked it, and I was still working at the time. And I got into my first couple of classes, and I was the duck. I was calm on the upside, but on the bottom, I was really pedaling, and I loved it. And I thought, oh, I think I found my home. And so I built on this branch of what I'll call traditional practice of healthcare architecture, and then moving toward public health and what I'll think is a little bit more service oriented than a commercial kind of application of architecture. And so I've been doing that the last 15 years, moving out of I'll call it the traditional branch of architecture and practicing just for myself. It's not a criticism of anything else, it just worked for me. And so I've been in commercial settings doing research, and I've been in academic settings doing research. So currently, I'm at the University of Arizona. I'm a research associate, which basically is I'm a freelance researcher with the environmental department at the College of Public Health. And so if I bring in a grant, I receive funding from the grants that I work on. And so, kind of two areas of things that I am trying to focus on. One is public health people have niches. It's kind of like the human body. People study it in parts. And so people study in public health in parts too, and sometimes holistically. So I study water as a niche in buildings. And so I specialize in waterborne pathogens inside of hospital buildings and that danger. And a broader, more service topic I'm working on is um, how do architects fit into disaster and resiliency and public health, and what can we do more from a service standpoint? And I came to that a little bit by accident through the COVID situation. So that's kind of what I'm doing right now.
Well, I think that's a great tie-in to Our Planet, Our Power, which is the theme of Earth Day this year. Your work around designing for resiliency in the face of the pandemic and other natural disasters was actually recognized by the AIA nationally. You won
Yes.
a commendation medal for that.
Yes, there were several things that happened. So just a little bit to digress, I from the healthcare group, I had been assigned to a national committee on health. And they tell you in disasters, you don't make your friends during the disaster. I mean, you will, but it's who you know before and the bridges that you've built before. So, about 3 years before the pandemic, I was on a um, committee for health and the built environment at the national level that was connected through their sustainability and the Cote 10 initiatives. And so I had made some folks there, I had made some colleagues and things. So suddenly the pandemic hits and they wanted to do a response to the built environment, both from a healthcare and a public health perspective. And as we started calling and talking, they really didn't know somebody that had both an architectural degree and an environmental health, public health background. I'm trained in industrial hygiene as part of the public health environmental part. So I was the appointed chair for the COVID response nationally and was kindly recognized as a citizen architect. I won a national award actually from Healthcare Design for that, and then was received an AI presidential commendation for the effort. And what we had done was we looked at alternative care sites and what you would do to convert non-healthcare settings into temporary healthcare settings, arenas, schools, hotels, that type of thing, to accommodate patients or people that were headed in, had become infected with the virus.
Yeah, and I think that's a really important thing to bring out is that when you are pursuing your interests and you're getting a diverse background, then you can apply it back to
Right.
more traditional things, but you're seeing things that others wouldn't.
Yeah, and you're introduced. When I was making that decision on branching on my tree, I went to people outside of the architectural realm and I said, I feel like I'm grieving my career. Am I leaving all this stuff behind? And a very close friend of mine who was a PhD in nursing, but he was the CEO of a hospital. He said to me, when you go the PhD route, avenues will open up to you and people you have never met and you would never meet unless you go this route. And it doesn't mean that all of that you're technically leaving behind is gone. It's just you're going to build a different foundation off of it. And this tree I'm talking about will branch differently and bloom differently and meet different people. And the question I had asked myself back at that time is, here I was in my 40s, and I said, do I want to be 65 and running a firm with all these people and having to sell it and sunset it? And that it just didn't appeal to me that it was just going to have that arc for me. And so I made that leap at the time. And he said, you'll just meet different people and just have this whole different cornucopia of stuff open up. And you have to relish in the unknown of that, as scary as it is in kind of a mid-career kind of jump like that. And so I have embraced that. And you have to get away from thinking that your career has a traditional, I'll call it a success arc for last, like a lack of something else, and that you're okay in being in this sort of unknown place that you're going to rebuild what that looks like.
Yeah, and you've talked before with me about having this crucible moment where you're like, I don't like this. And it takes a lot of courage, I think, to forge a whole different path. So, can you share a little bit about where you were at that time and why it felt right to make a very different kind of career move?
Yeah, I'm going to bring up three terms about this since we've talked about it. And I'm looking at a couple notes because I'm not a specialist in this, but, and I didn't know these terms when I was in it. I was swimming around in my head. And so there's three things. There's conscious capitalism, conscious leadership, and then the crucible moment that led me in those. So I was in a traditional architectural firm and it's a capital venture, right? It's a commercial industry. And something about that for me was, it's not that I'm against people making money or something, but I was looking for something more service oriented. And I was becoming burned out in the competition of that. And so conscious capitalism is moving away from a colonial capitalistic construct and moving toward um, revenue is not the only outcome that you're
Mm-hmm.
seeking. And so conscious capitalism might be running a business that's more sustainable, has or different goals and objectives than strictly a financial outcome, although that's one of them. And then I was involved in, I started thinking about this conscious leadership, which is a self reflection of awareness and expanding your own awareness. And I came to that because I was given a project, or I won a project, a commission to do an integrative medicine center. And as a healthcare architect, I'd been trained to, I don't know if you've ever done this, but be like a guest or a mystery patient. And so I enrolled myself in the program. And because I didn't know all the integrative medicine technologies and or methodologies or treatments that they were using to complement allopathic medicine. So I put myself through this and I started taking um, yoga meditation classes, formal mindfulness classes, acupuncture, and all these different things. And unbeknownst to myself, as I was doing that, I was slowly going back and my mind was revisiting things that had happened to me as a child. So I had suffered severe trauma as a child and I had unresolved trauma. And so as I was going through this integrative medicine program, I kept having, I knew these things were there. It wasn't that it was unknown, but now I'm having active recall. And it's
Mm.
kind of like this genie comes out of a bottle that's not going back in. And you're at the middle of your career. And one evening, I'm in the mindfulness class, and this instructor would close her class with a reflective yoga. And so I'm laying down in a room. There's like 20 some people, and it's dim and dark. And she has us do an exercise of reflecting a pebble dropping down in a well and how far it goes. And so she's just walking around, observing while we're laying down. And an event came back from my youth, and I popped out of my position laying down like someone in a movie, where you see someone comes out of their coffin and they go like
Wow.
this. And I came up out of it, and she recognized that I had had something happen. And so I looked around the room, and I recognized where I was. I came back into my body, and she just looked at me. And so it took me like a few weeks to approach her. And I said, she goes, something happened that night. And I said, yeah, I had a recall of an event from when I was a child. And I said, I think this has been going on. Like, is this what happens to you as part of being in a program like this? So I always tell people that I took this project to go in and design this integrative medicine center and admit myself as a patient to learn how to design. And what had ended up happening was I was learning how to redesign myself in a physical way. And so that became my crucible moment. And your crucible moment is something where you're going to go back, it creates a pause, and you're going to go back and it's not, some people might think of it as the old midlife crisis thing, and it's more than that. So this created a pause for me where I had to say, what am I going to do with this? Am I going to go back and heal from this and then move on? And that was the whole thing where I thought the career isn't focusing for me. This isn't working. And so I had to go back to a reset point. And that took me a couple of years to go through that process. And it's a journey at this point. Um, but that's when I moved into, okay, I think I need to look into different things. And for those that may want to read about crucible moments in leadership, I brought this. This is a very common book by Bill George, True North.
Hmm.
A lot of people have read this, where he talks about several leaders that came to their moment. And some people's crucible moments might be that they had a battle with cancer or heart disease. And it doesn't have to be health. It could be that you got married or you had children, or there's these other things that just your mind says, where I'm at, I need to do something different to make this all come together for what I'm talking about. Um, and then you go back and relook at that. So then I thought, okay, as I emerge out of that, I ended up going and getting my doctorate. And the conscious leadership was more all these, the change starts with yourself. I can't affect other things around me until I'm willing to change. So old paradigms in architecture and how people work and working all night or working in these patterns that we all learned in school that aren't healthy for you. I had to learn how to okay, this isn't working and I really need to rework this for myself. So that's kind of how I got into that whole process. And I'm now 15 years post that, all these events, and I'm a happier person. I'm pursuing what I want. And I feel like I rebirthed that career down a certain trajectory so that I could have something more lasting as I was getting older for me and have intellectual pursuits that I would enjoy.
Well, thank you so much for sharing that. There's a lot of vulnerability in that, but what is very powerful is your experience made you realize that you couldn't tolerate just this status quo or practice
Right.
as is. And I think all of us have those moments where we're like, really? This again? Same old, same old. There's a lot of things in our whole AEC industry that are very broken, and yet we just keep treading that water. And I really appreciate that you were willing to say, no, there has to be a different way that I can make a difference as an architect. And for you, it didn't look like traditional practice, but it also made you a little more fearless, I think, in saying, I just am not going to keep doing this anymore. I'm not going to co-sign on this way of working.
Yeah, it makes me think about a conversation I had with my husband back at the time when it was all happening. He's also an architect. And I don't know that this is gender based, but he said to me, I think a lot of men just get in and the tradition has been to just slog your way through it. And he said, I think that's just what we were taught and told. And this is the traditional pattern. And to himself, he said, I'm totally satisfied. He was totally satisfied with that because of the power of how he created and what he did. And while we were sitting and talking about that these so many years ago, I was like, no, I don't feel that way. I just don't feel that way about it. I do love the environment and architecture, but I said I don't want to slog through it for the next 20 years. I just don't think that's something I want to do. And I said I don't know if that's because of the gender. I don't know if it's because of the other things that have happened in your career as a woman coming up against old norms, et cetera. But I was like, I don't want to slog through this anymore. And I, I, I think there was something more personal about that in the whole public service and other things that I wanted to do that wasn't on someone else's trajectory as well. But I just told myself, I've always felt that the foundation of problem solving in the built environment that you learn in school is applicable to so many other things that I almost wish the degree wasn't solely about the built environment. because I feel these skills are very applicable in so many other professions. And we don't give ourselves credit for that, I think, in what great problem solvers we are. And so, anyway, those were things that I just felt were different. And thank you for recognizing that. And I want other people to know you can feel that way too. You just have to find a different way to apply those moving forward.
Well, especially sustainability, resiliency. This is very advocacy based work. Public health is very advocacy based work. And so you have to be very grounded, very centered, very sure of yourself that I like to call it the things you don't shut up about, right? Like I will do this work no matter what. And if I encounter a struggle or a roadblock, I won't take that as the clue to give up, but I'll keep finding other channels and keep going.
Yeah, it's a pursuit. Um, how do I describe that? Is you're tapping onto something I think a lot about with I just think traditional career paths are defined and a lot of them are based on goals and finances and things like that. And when you move over in this advocacy work, it's just a longer term mission and you have to let it unfold as it comes. And I think also I was totally happy, or I have been happy that I did that part with the traditional career part, and then I just needed to shift, right? Um, I don't know if it would have worked if I'd have just not done that coming out. That wasn't my journey. My journey was to add these two things together and figure that out. And it's more rewarding for me as you go through that. Because the other thing in public health is you can often be working with people in crisis and you can't be in crisis yourself.
Mm-hmm.
Just like
Mm-hmm.
someone who's a psychologist or whatever, you don't want them in crisis while they're dealing with people in crisis. You need someone that's very grounded, as you said, in what they're doing. And so for me, that was I feel that from a universal perspective, that was this unresolved trauma for me, right? So once I got that settled out, I had a better foundation for me to sort of look around and feel safe and in what I was going to explore.
Yeah, so now you are an integrative environmental specialist. So you kind of come up with a way to incorporate both the public health and the architecture. So what exactly does that mean? And if somebody would want to, also maybe identify with that idea, is that something they have to kind of DIY for themselves, or is there a way you would recommend they could get to that same place?
Well, if you're talking about people that are currently in the built environment space, so when I was in the integrative medicine project, what kept happening was a lot of the physicians and staff and people talked about their environment. And hopefully I don't know how this is going to come off, but I found that they all wanted to find themselves as experts in the built environment, and yet they were in medicine and other things. They really didn't have a background in the built environment. And suddenly they were experts in color and light and these other things that they really had no background in. And they would make statements in meetings where I would think, that's not what the science says about that. And even people that have looked into broad evidence-based design initiatives would know more than some of these people were stating. And I kept thinking there's a role in there for someone with a true built environment, true healthcare or health background. But you don't always want to look at that from a medicine point of view because I have a lot of folks and I know you have some things too where you explore the built environment as medicine. But in public health, we wouldn't be able to say that because that crosses a boundary in medicine of how things are defined. So we would call the built environment a non-pharmacological intervention. That would be the correct term.
I
So
like that.
the built environment is actually it's non-pharmacological, right? It's not a treatment. But we might be able to make it into an intervention, right? If
Hmm.
it could be
Hmm.
prescribed, but we haven't really gotten there yet. Now we're getting close with nature and, how many minutes a day. So in order to be a non-pharmacological intervention, you actually have to be able to have a dose, how much a day, kind of like exercise, 20 minutes a day does this and this. And there's enough research starting to emerge, like on nature, views of nature, where that is coming about, right? But we might not have that for lighting, or we might not have that for color, or we might not have that for volume and scale. And so, medicine, if I went into a meeting with medical professionals and said the built environment is medicine, I'm like suggesting something's being injected into the body. So we look at it as a non-pharmacological intervention. And that's what a lot of integrative medicine therapies are. They're non-pharmacological interventions if you're going to do mindfulness or it's going to have this other impact to you. So I kept thinking, is there a way for us to proceed as built environment professionals where we can continue the research to get to this level of calling it a specific intervention? And I think many of our colleagues in medicine have come around to some of this. But what exactly does that mean? And these definitions already exist. And what I would welcome is that I sort of stumbled into this environmental sector in public health. They they study the built environment in its components: air, water, indoor environments, outdoor environments. We tend to look at it holistically as a building, right, in all of
Hmm.
its
Hmm.
components. And so they don't have a person that talks about that holistically. And that's where I think those of us in the built environment, I'd like to see more architects pursue either a public health and a master's in public health. You can take a subspecialty in environment, and you would learn about the exposure sciences, and that would lead someone to be able to talk more about this holistic environmental approach, a non-pharmacological intervention. I think it would be a direct overlap, but there's been a few that have done that, but not so many. So I would encourage people, instead of the old tradition that you need to go get an MBA if you're an architect or something, if you're really into health, I would encourage people to get either a certificate in public health, which is available through online education. It's a 5 course structure. And then you can apply that if you really loved it to a master's in public health that are often available online as well.
Well, that's a great suggestion. I think especially for people concerned with the environment, public health and the environment, we know, are incredibly linked. It's that whole exposome that people are within, and being able to talk more comprehensively and intelligently about
Correct.
that can go a long way. Even if you are still practicing within a firm, being able to attract the clients that are more willing to do these larger scale changes, I think it matters a lot, because now we're not just talking about a building, we're talking about a community. It
Correct.
expands the scale of the work.
Yeah. So there's medicine is, technically speaking, is a individual prescribed approach. It may be based on things that happen as a population, but it is a one-to-one from its provider to the patient, right? It's a prescribed, treatment plan, right? And public health is about studying the community, whether that community is a community of smokers or that's a community of children or whatever. You study these various communities, and then that reports on what you might do at an individual level. And I feel that architects, traditionally, public health has been thought of a lot in architecture as urban design, where sidewalks are and transportation and these in broad, very, very broad things. And that is all true. But for those of us that are tangentially, we're practicing at building a building and the occupants of that building, those occupants of the building and the impact it's going to have on them comes from a public health directive. And it can be much more scaled down to that interaction with the building. And so I'd love to see more course structures that related. Yeah, I've always had my goal in life after the public health was, could we come up with like a mini curriculum for the built environment professional for them to hear about exposure science. And so it would be tailored to them as opposed to the very broad part. I took the difficult route of going through the whole thing that way, but there are a few people talking about doing that as we advance the built environment.
Yeah, I think it's a great idea. I would love to see that something that's out there and talked about and offered more. Even having a public health class, even
Correct.
one class, could make a huge difference, I think, for people because you've talked before about the idea of the difference between a workaround where somebody's just trying to get by and, maybe adjust their own process to the environment in which they're in versus a conscious environmental adjustment that encourages healthier behaviors or activities.
Yeah, so I got the workarounds are a word I learned in nursing. So if you go in and you're talking to people about something and they have a policy of how they're actually going to do something, let's suppose something goes wrong and they have to adapt the policy. Eventually, the policy has to get changed, but that takes longer, right? So they would do a workaround. So they come up with interim steps. But then a lot of us in our lives, we never fix the workaround, right? We just keep doing the workaround. And the workaround has like a logarithmic level of dysfunction to it, right? Where you have people doing the policy, then you have people doing the workaround, et cetera, et cetera. And so I think we do that in all professions, and I think we do that in all different parts of our lives. And I was in a meeting once with a nurse who said, I just don't want to do these workarounds anymore. I think we should have a time limit on them, like days or a week or something. And then you immediately have to get the policy and rework it and rework the steps so that it works and reissue that. And so when I'm trying to deal with environmental things, I think you want to leave room for flexibility of what has to happen. But instead of getting yourself into these workarounds and then people are just constantly living in that, how can you translate that over to something that becomes more environmental policy that is safe, it's efficient, and that equals it's sustainable. If it's not safe and it's not efficient, it's not sustainable. One of the things I feel has been holding architecture back is that when they came up with these building efficiency programs, people just think that if it's efficient, it's sustainable. It's not.
Mhm.
That's not the definition of sustainability. Sustainability in public health is it has to be safe and secure, has to be efficient. There's many more factors in order to lead to a sustainable thing. And so you don't want to find yourself left in workarounds because that usually is not a sustainable position.
Yeah, absolutely. Because I think when we only look at the lens of, say, energy efficiency or, the typical things that architects tend to look at, first of all, they depend a lot on human factors. We've all had the
Correct.
experience of the very intelligent, sophisticated mechanical system that somebody overrode all the controls on, and so then it doesn't work the way it's supposed to.
Right.
Or things that don't really match the needs of the occupants, so then they get turned off or changed. And I think it really is important that there is that bigger, more holistic picture and that it actually does work over time and work in a variety of situations, not just in the situation that you might have been thinking about when you were doing the design.
Correct. You have to be, I've always been a person that I take this from when I used to do construction administration and worked in California. I would go out to a site and we had a lot of power there. I mean, if something was going wrong, I could shut that site down. But my attitude was, well, let's work with the contract. Let's work through the issue. They're not trying to do something to harm the process. They just don't know, right? And so I always found myself is that, okay, here's the letter of the law, and we will have to meet that. But let's see if we can bring something together about whatever's going on at this site that isn't working because of that to get us to meet up to that letter of the law, right? And you have to be flexible and listening to people so they can tell you why they're having difficulty meeting this policy or this law or whatever. And I just found that when I did that, I just got a lot more cooperation in getting to the same end result by communicating with them differently in the field. And I've taken that into public health and other areas too, is that I need to be flexible, but we are still trying to meet the intent of safety and other policies that are out there. And so, but you have to listen, and you have to do that a lot in disaster and resiliency as well.
Yeah. So, what is the best way then to really have that advocacy role? I mean, you've done it through making that career shift, but you've also done it by being engaged in a lot of different organizations and being able to lend your expertise there. So, what advice would you give to others who really feel called to create that more resilient, sustainable, healthier planet?
I think as I have opportunities now come to me, I learned something from that same US Surgeon General one time. I said, how do you pick your opportunities? Because have you ever heard of the shiny object syndrome?
Oh,
The
yeah.
next thing comes up and people are all engaged because they want to be engaged. And he said to me, I don't book my calendar 3 months out. I said, what? He said, I don't book anything 3 months out. And I said, well, what's your rationale? And he said, well, because there can be, at the time, this hadn't happened, but he said, there can be a world pandemic and you have to respond. And he said, you go through a lot of canceling. And he said, and I said, well, that fits for you because you are, former US Surgeon General. I'm not on this ranking level at all. And he said, maybe you want to try it. You might find it's helpful. And so I started working with a more limited schedule. And I really only put things on there that fit my scope or fit the direction. I have two, maybe three things a year, or then it's evolving over years that I'm involved with. And if it really doesn't fit the pattern of what's developing there, not that you can't take on something new, but I don't over jam that up anymore. I used to feel like I had to have everything full in order to figure out, building all these relationships and everything. And I found I have way more flexibility if I just take a few things on that are plenty big enough to keep you busy, and then I turn more things down, or I don't overbook myself to allow opportunities to come to me. And then when something comes that's right in your sweet spot, then I feel like I'm ready, right? Because I haven't taken on too many distracting shiny objects, for lack of a better word. And it takes a while to filter and get comfortable with that, because I don't think that's what you do in the traditional, it kind of in the traditional architecture realm. It was like, we have to apply for every project. We've got to go after everything. Our calendar has to be completely full. And then we're going to get a percentage of what comes down the pike, right? And I feel it's the reverse. We need to add what's appropriate and then take on what works, and then learn that that's what I'm supposed to put my energy into rather than the other way around. And that takes some different skills to approach that. But I would be more selective than trying to do the wide gunshot routine of being involved in too many things. Pick the things that resonate the closest to you. So for me, I still respond to being a healthcare architect, and so I keep tabs in that area, and I build that on to what I can contribute in public health, because those things resonate with me deeply. But other things may not. And so I had to learn to let those go, even though they were part of the traditional approach. And I think each person has to look at that and their skill sets and likes and dislikes, et cetera. And also what you're doing with your family or any of the other people you have around you, to do some of that.
And I think that's great advice. Like, do what you love, and then the opportunities find you, and you have the availability and the flexibility and the clarity too to say yes to the things that really resonate and not get your time siphoned off by the things that don't.
I think it's less stressful, um, because my joy, and because I'm building on something, my joy is there. And so these projects are very joyful for me. And I felt in architecture, it was that way in the beginning, but then it got to be something that was burdensome to me. And I thought, I'm not feeling that joy. And that's where I felt like I was getting run down and burnt out in it. And I think you have to find that place and not want to go. I didn't want to go back there.
Because you focused on water. Why water, and how does water really impact us? I don't think people fully understand the scope of its impact.
Well, I have to tell a little bit of a story. So it's a bit of an accident. I didn't do my dissertation on water at all. I did my dissertation on nursing stress in a hospital and exposure to nature. Um, so I was in my end of my doctorate, and the Center for Disease Control had awarded a grant to the University of Arizona about waterborne pathogens. And my advisor came to me and said, "Didn't you build a hospital, design and build hospitals for a living?" And I said, yes. And, it was like the first time somebody actually resonated back with me, like, "Oh, I think you're a licensed professional in this." And I said, yes. And I said, "What does that mean?" She goes, "They want to talk to us about waterborne pathogens in hospitals." And she was a municipal water expert for water, coming to your residences. And she's worked in healthcare transmission of disease. And she said, she said, "I don't know that I can speak engineering to some of these people." And I ended up going to this, and we had always in our profession protected for airborne pathogens using infection control risk assessment, the ICRA process. And they handed all of this to me, and I instantly had this awareness that this needed to be developed for water using the ICRA process. And it was like I was speaking a foreign language to these water scientists. So I made it a passion, and I've been writing about that. So what happens is when you deliver water to your home, other than the distance it comes from a municipal provider, the piping that comes into your home is relatively short from the invert to the street. When it comes into a building as large as a hospital or a school or any large building, it travels literally thousands of feet or miles, to get to the point where it's dispensed at the tap, and it can collect biofilms. So the more we save water in buildings, actually, the more harmful it becomes,
Mm.
because the residual disinfectant and the stagnation of the water in the line from not using it, and the buildings are still being designed as if it's high level of flow. So the buildings are being designed for high flow, but there's this very low amount of water being used. And it's actually creating pathogens in the water, or not creating them, but it's amplifying them in the water. So a lot of people think you turn on your tap and it looks clear and it comes out, but they don't realize that that has pathogens in it. And you might be able to drink those and not have harm, but if you inhale them, it can be harmful to the lungs. And so there's thousands of these gram-negative pathogens. So I was able to develop a process that's been published, and I'm trying now to do case studies to help contractors and building owners, architects, and engineers understand that this water should be commissioned in the building. I'm not sure why, but I think every other component in a building that a patient comes in contact with is literally tested or inspected or commissioned, except the water. Water is not tested prior to use by patients. And so I'm trying to see if we can get that changed in the future and eliminate unnecessary disease cases and deaths that occur from it. So I don't think, would you want to go to a hospital, survive an open heart surgery, but be killed by the water system?
Yeah.
That literally can happen. And or go for cancer, survive the disease, and be killed by a lung infection from the
Yeah.
water system. So a lot of people don't realize that it's that dramatic. And it doesn't happen all the time. No, a lot of these places are very safe, but the hospitals have not managed their systems until were forced to through some Medicare and Medicaid policies starting only in 2017. So it's relatively new. Um, so I got into water as kind of a niche topic by accident through this invitation, again, through something I hadn't planned on. But I've been able to advance it, and um, it's unique to me. And everybody, when I say I'm a licensed architect and an environmental scientist studying water, people go, "Whoa, wait a minute!" They have to readjust their head. And I go, "Yeah, that's the only reason I think I know how to apply this differently. It takes an outsider, how they
Mhm.
describe that. And so I'm an outsider sometimes in public health, looking at it from that built environment perspective. And then I'm an outsider in built environment because I'm looking at it from the environmental health perspective. So you can be this observer, and I can see things that maybe other people have been traditionally doing that they just didn't recognize before. So that's how I got involved in water.
That is so cool. I didn't realize that whole story, but also like I'm thinking, well, how many schools have sinks in classrooms and those sinks
Yeah.
don't get used all the time? And this is a lot more pervasive than just healthcare. So I love that you're doing this research and love everything that you shared today from your own career path to ways that you are connecting public health and architecture and the environment all together. If people would like to learn more about your research or maybe participate in a study, how can they connect with you?
The best way to connect with me is through LinkedIn. Just it's my name with my background. So Molly Scanlon, the PhD. If you go onto LinkedIn, you can see my background and profile. You can ask to connect with me. Um, I will hopefully next this coming year, I'm going to be opening some case studies for healthcare in the built environment about water specifically. And at the Summer Leadership Conference, I'm actually going to be there talking about the disaster and resiliency as a public health architect. So if anyone wants to get in touch with me or just connect with me and follow, they can do that best through LinkedIn. And if they have something more important they want to share, message with me through there, and I'll be able to share email, etc.
Very cool. Well, again, thank you for being the guest today. I loved our conversation and I look forward to hearing your talk at the SLS.
Yes, thank you for having me, and good luck to everybody out there. And just look into yourself and see what you want to do. There might be a mystery in there that you just don't know is going to unfold.
Absolutely.